Hi, my name is Kiru, and today we're going to talk about postpartum psychosis, and it's also known as PPP. So, just an overview of this presentation. First, I'm going to go over some important statistics about postpartum psychosis, and then I'm going to discuss risk factors, and then I'm going to talk about symptoms. I'm also going to talk about how postpartum psychosis is diagnosed, and then I'm going to talk about treatment. So, some important statistics about postpartum psychosis include it's considered a psychiatric emergency and it requires pharmacological management and hospitalization. It's also known as puerperal psychosis and postnatal natal psychosis. It affects between 0.089 to 2.6 out of every 1,000 births. Globally, PPP happens in between 12 million and 352.3 million births, or 102 out of 1,000 births globally. Even though postpartum psychosis or PPP is treatable, most people with postpartum psychosis do later develop bipolar disorder. Postpartum psychosis risk factors. So, postpartum psychosis occurs in the first to 6 weeks after birth. It comes on suddenly and involves rapid mood changes. Postpartum psychosis is due to hormonal changes, and it is common in women with a diagnosis of bipolar or have a close relative that suffers from bipolar. It's also common in women with a diagnosis of borderline personality disorder and schizophrenia. It's also common in women who experienced a big change in their mood during their pregnancy. Nevertheless, postpartum psychosis is very rare and it occurs in 1 in 20 new moms. The symptomology of postpartum psychosis is as follows. People with postpartum psychosis experience delusions and sometimes they experience hallucinations. They experience paranoia or suspicious thoughts and beliefs. They have experienced insomnia, disorganized speech or behavior. They're often confused. They experience hyperreactivity. They experience cognitive dysfunction. They experience appetite disturbances. Often, people with postpartum psychosis have suicidal ideation. They have feelings of disconnection from their new babies. And in extreme cases, women with postpartum psychosis may have feelings wanting to harm their baby. But let's have a more comprehensive understanding of postpartum psychosis and their symptoms. There's three types of symptoms for postpartum psychosis, and they're categorized under three subtypes. Those three subtypes are depressive symptoms, manic symptoms, and atypical mixed symptoms. So, depressive symptoms is a subtype of postpartum psychosis. It's the most common symptom that women face with postpartum psychosis. 41% of cases of postpartum psychosis are people who experience depressive symptoms. These symptoms, in combinations with psychosis, are the majority of cases that involve self harm and harm to a child. Suicidal ideation and thoughts of harming a child are especially common when a mother has depression and also experiences hallucinations or delusions. The rate of harming a child in women with postpartum psychosis and depressive symptoms is 4.5%. This is 5 times greater than any other type of subtype of postpartum psychosis and the symptomology. The rate of suicide in those that have depressive symptom subtype of postpartum psychosis is 5%. The common symptoms of depressive symptoms in the subtype of postpartum psychosis is anxiety, panic, delusions, a loss of appetite, a loss of enjoyment of life, and feelings of guilt. The second subtype is called the manic symptom subtype. This is the second most common subtype of postpartum psychosis. It affects 34% of women with postpartum psychosis. There's a risk of self-harm, but it's lower in women with manic symptoms and who are experiencing postpartum psychosis. 1% of women want to self-harm when they have manic symptoms. Other symptoms that accompany the mania subtype of postpartum psychosis include aggressive behavior, rapid speech, insomnia or needing little sleep, delusions of grandeur of oneself or delusions of grandeur of the baby. This is often feelings that the baby is God or sent from God for a mission, has a special mission. Finally, the third subtype is atypical mixed symptoms. So this makes up 25% of cases of those who have postpartum psychosis. It's considered a mix of manic and depressive symptoms. The most common symptom is that the person with this subtype of symptoms is not present, so they have a lack of consciousness. They're not aware of what's happening around them. Other symptoms that accompany this subtype include confusion, disorganized speech, a lack of consciousness, hallucinations, delusions, inappropriate behavior, and comments, and also mutism. So often people with the atypical or mixed symptoms of postpartum psychosis will often be silent for long periods of time. It's not very clear why they're silent, and they may take it may take them some time to come out of that state. So, how is postpartum psychosis diagnosed? So, a mental health professional is the best person to diagnose postpartum psychosis. Mental health professionals can diagnose through observation of the patient, but also through blood tests and urine tests, imaging scans, or specialized screening tools or questionnaires. So, in hospitals, these mental health professionals can look like psychiatrists, nurses, and even sometimes a doctor. So, treatment. So, in terms of treating postpartum psychosis, we should remember that it is a temporary condition and it is treatable, and people with postpartum psychosis can recover within a few weeks of treatment. The conditions, even though the conditions are varied and there's many conditions, it is dangerous and severe if it goes untreated for long periods of time. Due to the rarity of those illnesses, however, there's limited research on how best to treat this condition. Since it is an emergency condition, it does require inpatient treatment and management in a mental health facility. Often, this will be involuntary because most women with postpartum psychosis are unaware that they have a mental health issue. Treatment also includes medications, and sometimes people do have electroconvulsive therapy to help them with postpartum psychosis. Finally, recovery time for people with postpartum psychosis is client specific, and your healthcare provider will be the best person to provide a guidance on recovery. This is my presentation on postpartum psychosis. My references are as follows. Thank you for listening.